Hello. This is Sudharshan, and in this episode, we will talk about renal pharmacology part 1, that is diuretics. So, diuretics are basically the medications which are going to promote the sodium and water excretion into the urine. So, coming to the classification of diuretics, it is divided into 5 important parts. 1. Drugs on the PCT, then the Henle's loop. In the DCT, we have early and late, and on the entire nephron. So first let us see on the PCT, we have the carbonic anhydrase inhibitors, that is acetazolamide. As the name itself tells, we have the mechanism of action blocking carbonic anhydrase that does the reversible conversion of carbonic acid into bicarbonate and H+. And coming to the uses, it is used in altitude sickness, in glaucoma, in metabolic alkalosis, then also in pseudotumor cerebri. And coming to the side effects, mainly we have this paresthesias and congestive heart failure. Even hypersensitivity also might be seen. Along with that, we can also have headache and renal stones. And it is contraindicated in 2 conditions, liver disease and COPD. So why COPD? Because as a side effect, it will cause metabolic acidosis. And mainly why we'll use in metabolic alkalosis to acidify the urine. Maybe in that process, it will lead to COPD, where there is a disturbance basically in the acid-base balance. Right, so that was with the carbonic anhydrase inhibitors. Next, coming to drugs in the Henle's loop. We have the loop diuretics. In that, 3 important drugs, furosemide, bumetanide and torsemide. And coming to the mechanism of action, they will block the Na+, K+ and 2Cl- channel, or NKCCl2 transporter will be blocked. And then coming to the side effects, coming to the uses, it is used to treat mainly edema, systemic edema, hypertension, and also sometimes even volume overload. And coming to the side effects, we have different electrolyte imbalances like hypokalemia, hyponatremia, hypocalcemia and hypomagnesemia. So electrolyte levels are reduced. And metabolic disturbances like hyperglycemia, hyperlipidemia and hyperuricemia, that is nothing but gout. And also it causes ototoxicity and hypersensitivity. And another important point with furosemide, the trade name is Lasix. Now coming to the drug interactions, it will interact with different drugs like digoxin, aminoglycosides, NSAIDs, lithium, with amiloride. So with amiloride specially, it affects the lithium and the sodium reabsorption from the tubules. And all these loop diuretics are sulfur drugs. And epicrenic acid, that is also another important loop diuretic. So that was with the loop diuretics. Now let us move to the drugs in the DCT. First, in the early DCT, we have the thiazide and thiazide diuretics and the synthetic versions. So coming to the thiazide diuretics. So the drugs in this class like chlorothiazide, hydrochlorothiazide, then hydroflumethiazide, then bendroflumethiazide and benzthiazide. So these are the medium efficacy drugs. And with the mechanism of action, they are going to block the sodium chloride co-transporter. And when it comes to the uses, they are mainly used to treat hypertension, edema, hypercalcemia and calciuria, where calcium is more in the blood and urine, and diabetes insipidus. And also it is used to treat acute renal failure, ventricular failure. These are the conditions where there is disturbance in the volume overload. And coming to the side effects, very commonly as that of the loop diuretics, electrolyte disturbances like hypokalemia, hypocalcemia, hypomagnesemia, and hyponatremia. And with the metabolic ones like hyperglycemia, hypertriglyceridemia, and hyperuricemia. Apart from that, hypersensitivity as well. And there are and also coming to the drug interactions, the thiazides will interact with the loop diuretics as well, and even lithium also interact with the thiazide diuretics. And coming to some synthetic thiazides, like we have chlorthalidone, indapamide, and zipamide, and metolazone. These are mostly used to treat hypertension. Furosemide is not used because of short duration of action. Instead, these are the synthetic variants which we are going to prefer. And next we will come to the drugs in the late distal tubule. Very importantly, K plus or potassium sparing diuretics. We have spironolactone, eplerenone, amiloride, and triamterene. So they are nothing but they are the competitive receptor blockers for aldosterone. So mainly the mechanism of action, they are going to antagonize the aldosterone. They are going to bind to the aldosterone, which is a mineralocorticoid. It will bind to the receptor, activate the mRNA, and activate AIPs or aldosterone induced proteins. And there is a competitive antagonism. This is important. Competitive antagonism occurs. And mainly they will act on the collecting tubule. Yes, so coming with spironolactone in detail. So the trade name of spironolactone is aldactone, and coming to the uses in heart failure, edema, and hypertension, and also hyperaldosteronism, that is in Conn syndrome mainly. And with respect to the side effects, and also it is used in congestive heart failure as well. Now coming to the side effects, there will be endocrine effects. In males it will be decreased libido, and in females it will, and gynecomastia. In females it will be irregular menses. And also we can have the GI disturbances, CNS disturbances may also be observed sometimes. And very importantly, patients should avoid potassium supplements because these drugs itself block the potassium, and by giving potassium supplements we are only worsening the condition of the patient. And a very important drug interaction of spironolactone, that is with ACE inhibitors. Here we see a dangerous hyperkalemia, that is the side effect, because potassium is not reabsorbed by the collecting tubules. And finally we have the osmotic diuretics, which are going to produce an osmotic effect, and they will act on entire nephron. And these drugs are mannitol, glycerol, and isosorbide, dinitrate and trinitrate. And mannitol is the most important one. So first, mannitol, the trade name is osmitrol. So what is the mechanism of action? Initially, when 20% IV mannitol is given, there is increased plasma osmolality. Then the fluid shift is observed, that is from ICF to ECF, and because of that the glomerulus starts to work more. When the fluid reaches the glomerulus, then the GFR process is there, that is glomerular filtration rate, where we see the increase in tubular fluid osmolality leading to diuresis. So very important difference. Initially plasma osmolality increases, later tubular fluid osmolality increases. And coming to the uses, we have glaucoma and drug overdose, especially with aspirin, and also in renal failure. And coming to the side effects, side effects, it will lead to GI side effects, metabolic side effects, and contraindications of these drugs in congestive heart failure and anuria. So that is all with the osmotic diuretics. So thank you so much. We'll see you in the next lesson.